sponsored by the Carpal RX. Every year in the United States, millions of people are diagnosed with carpal tunnel syndrome. This video will summarize the symptoms, the cause, the diagnosis, and the treatment of carpal tunnel syndrome. Symptoms of carpal tunnel syndrome generally involve the hand and/or the fingers. They include pain, numbness, and tingling, but not in the little finger. These symptoms make it difficult to do everyday tasks, especially when those tasks involve grasping and dexterity. Often, patients are awakened at night with the feeling that they need to shake out their numb fingers and hand. While nobody understands why carpal tunnel syndrome occurs, its cause is well known. It's actually a disease that affects an area inside the wrist known as the carpal tunnel. Inside the carpal tunnel, your flexor tendons, here shown in white, are very close to the median nerve, here shown in yellow. The tendons are surrounded by a fluid-filled sheath, here shown in blue. Under certain conditions, like rapid hand movement, that sheath begins to swell and it pushes against the median nerve. And that causes all of the symptoms of carpal tunnel syndrome. Therefore, for any remedy to be effective, it must solve the underlying reason for the swelling and not just temporarily relieve the pressure caused by the swelling, as surgery does. Several methods can be used to diagnose carpal tunnel syndrome. Most commonly used are provocative tests and electrodiagnostics. Provocative tests are when certain taps and pressures are applied to your hand to reproduce the symptoms of carpal tunnel syndrome. Electrodiagnostic tests, including EMG, tend to be somewhat painful. They generally use thin needles to detect whether current passed up and down the median nerve is slowed down inside the carpal tunnel. Treating carpal tunnel syndrome should be done using two well-known and effective methods. The first is resting your hand in a splint, especially at night. The second method is to have deep tissue massage on your wrist and forearm. But this isn't your everyday massage. It requires specific motions on your wrist and forearm in order to drain excess fluid buildup from inside the carpal tunnel. It also serves to break up the adhesions around the tendons, which caused the inflammation and fluid buildup in the first place. But to be effective, it must be performed twice daily and for 2 to 4 weeks. But you don't have to visit a therapist every day to get this treatment, because the Carpal RX will do it for you. And if you've heard surgery is the only cure for carpal tunnel syndrome, be aware that studies show most people don't need surgery, but merely the treatments previously mentioned. That's because deep tissue massage acts on the tendons, causing them to lose their inflammation, which is precisely what the Carpal RX does automatically, but surgery does not. The Carpal RX will give you this identical treatment. It comes with a true 100% guarantee because it targets inflammation. The Carpal RX always had and always will have a 60-day risk-free trial, which means if you're not satisfied for any reason whatsoever, you get a full unconditional refund of all of your money, including return shipping costs. If you suffer from carpal tunnel syndrome or wrist tendonitis, you have nothing to lose by trying this remarkable product. Remember, it's the only product backed with a 100% guarantee to permanently and easily get rid of carpal tunnel syndrome, wrist tendonitis, or repetitive strain injury. Learn more at carpalrx.com.